To perform the transtracheal wash, fill the 12 cc syringe with normal saline. Attach it to the three-way stopcock. Attach the larger syringe also. Clip and scrub the laryngeal area with betadine and zephyrin or alcohol. Palpate for the cricothyroid membrane. Aseptically block the needle puncture site with approximately 1 cc of lidocaine using a 25-gauge needle. Then repalpate for the landmarks. Pick up the skin and insert the needle through the skin at this site, bevel down. Now stabilize the trachea with your other hand. Recheck the position and insert the needle bevel down at about a 45-degree angle through the cricothyroid membrane. The needle should move fairly easily. If cartilage is encountered, recheck your position and landmarks. Advance the catheter while holding the needle steady. The dog will probably cough as you do this. The catheter should slide easily. When the catheter is fully advanced, withdraw the needle to just outside the skin and attach the needle guard. Remove the sterile sleeve from the catheter hub and remove the stylet. Attach the prepared dual syringe system. Depending on the size of the dog, flush 2 to 5 cc's of saline into the trachea. Quickly adjust the three-way stopcock and aspirate with the other syringe. Short, quick aspirations usually yield better results than long, slow ones. When the aspirating syringe is filled with air, detach it, expel the air, reattach, and continue suction. Repeat flushes and aspiration 1 to 2 more times as necessary. Be careful not to pull the catheter out of the trachea during these manipulations, and always be aware of its position in relation to the dog. When the wash is complete, remove the catheter from the trachea and apply pressure to the puncture site for a minute or 2. Submit the wash sample in an appropriate container for culture and cytology. To perform the endotracheal tube technique, prepare the saline-filled and empty syringe and stopcock as for the transtracheal technique. Cut a small segment of the urinary catheter sleeve so you can sterilely pass the catheter, or you can wear sterile gloves when passing it instead. Place an IV catheter and tape in place. Give SURITAL to achieve a light plane of anesthesia. Flush the catheter with heparinized saline. The animal should have the cough reflex at this plane of anesthesia. Use a laryngoscope when intubating the animal to avoid oral contamination of the end of the tube. Hold the animal's mouth closed over the tube so it is not coughed out after being placed. Aseptically pass the sterile urinary catheter down the center of the endotracheal tube. Be gentle and stop when resistance is met. Attach your syringe and stopcock system, then flush and aspirate as described before. When the wash is complete, remove the urinary catheter, but leave the endotracheal tube in place until the animal's swallowing reflex has returned. Appropriately submit the samples.